all of our tissues in our body as women have responses to estrogen and are biologically active to hormones. And so, hormones themselves, the breasts themselves actually can respond to the estrogen. And so that's what you're experiencing. So the tissues are starting to get that estrogen on board, and sometimes the tenderness can happen as a result. Typically what we recommend is just to try to avoid like overstimulation to the area. So same as like when you have breast tenderness, when you would have your periods in the past, often if it gets really bothersome, you can take anti-inflammatories like Motrin or Advil, ibuprofen if need be. But this is a temporary phenomenon, and it typically will get better on its own. If it does not get better after 2 to 3 months of treatment, then that might mean that the estrogen content might be a little bit high for you. So we might need to tweak the dose a little bit. But this early on, I wouldn't recommend changing your dose just yet. Just wait it out, and it will get better.